we have doctors taking up Uber driving because they can't pay the rent.
There's a lot of fear about privatising the NHS.
£3 billion. Where did that money come from?
Are there people that are just being left behind by society?
Nurses are turning towards food banks. No system can replace the NHS.
Talking today to Dr Anita Raja.
Joining us now from Birmingham is Dr Anita Raja, who saw in that film.
I started work at 8:30, and guess what? I've already seen 18 patients. And the BMS suggests that we should not be seeing more than 25 patients a day.
She's a leading healthcare provider. Just want to find out from the healthcare point of view how people are doing in Britain, economically, socially. Is it broken? Is there a way to make things better? What solutions and what possible good future can we build? So Dr Anita, where are we today?
We're in the heart of Birmingham in the Jewellery Quarter, and we are standing exactly out of House of Health, which is my private clinic.
You're one of the nation's leading healthcare professionals. You work privately, you work in the NHS, you come on TV, you come on broadcast. You're passionate about people, about health. And health is like such an excellent meeting point to explore notions of community, belonging, welfare, poverty, which are themes that we're interested in. There's no doubt we're at a time where social cohesion is it feels like an all-time low. Muslims, Jews, whites, blacks, everyone feels threatened, feels left behind. From your vantage point, from the view of the eyes of the the patients that you're sitting with, what are they telling you about belonging and how they feel in today's Britain?
There's a huge gap, especially when it comes to people from the ethnic minority groups. They feel that they are not able to get their voice across to people that are making decisions, are decision makers. They feel unheard. They feel that they're not well placed when it comes to areas of healthcare, areas of social care, and I think they're burnt out and they're burning out. And they are victim of social isolation because when you are struggling to meet everyday needs, which is, unable to get food on the table, when you're unable to pay your bills, when you are suffering from poverty, I think that in itself can lead to massive problems like mental health breakdowns, relationship breakdowns. And in the end, I think these people, whether they are from the ethnic minority group or not, feel isolated socially because there's no one to help them. In Islam, we have a concept of ummah, which means community, and the idea is that the whole community comes together and helps each other. Now, this is not exclusive to one faith, it's not just exclusive to Islam, it is for anyone and anyone around you. If we would follow that, which is something that I certainly think we are lacking in the West, where most of us are victim of social isolation, not so much when we speak about third world countries where people are poor, don't have the wealth, per se third world country, but the community is still there, the sense of community is still there, people are still looking after each other. If you would follow that, then there'd be people looking after a neighbor, an elderly resident, there'd be businesses that would take on, youngsters to just teach them things like, apprenticeships and things. I mean, then we would actually look after each other. I think the one thing that is missing from Western society certainly is the sense of being an ummah.
Being an ummah or being ummas? If you said communities and cohesion, you talked about inside with ethnic minorities. You gave an example of, I think you mentioned ethnic minority people often have stronger internal cohesion. You talked about everyone pitching in to pay for their grandma's health. You gave an example. What's the view that you're seeing about community cohesion in general then?
When it comes to, because I work for the NHS and I work privately as well, private healthcare is a payable service, which essentially means that you can access care, but you will have to pay for it. And what we have seen is that 90% of people who are accessing care are people who are not necessarily rich. These are people who are on normal wages, doing a 9-to-5 job, but coming together as a community to look after their loved ones. Now, a very good example, which happens time and again and makes me immensely proud, is the fact that if a grandmother is unwell, 5-6 grandchildren or children will come together, pool in money, get her seen and get her sorted. And I think people now understand that that is the future of healthcare, in the sense that the NHS is great, does amazing things. No system can replace the NHS, but the private healthcare is here to support the NHS in acute situations where, you know, which is much well placed and suited for private healthcare. For instance, if you have a cough, if you have a cold, if you have a skin infection, you know, things where you need to access care much quicker, but it's not necessarily life-threatening yet, private healthcare comes in.
Okay. So there's a few things I'd like to pick up in the conversation today. The private-public part I want to come back to.
Yeah.
You've spoken about the need for communities also being part of support.
Yeah.
And you've spoken about the role of poverty
Yeah.
in accessing services. If I start with this one first,
Yeah.
what's the scale of poverty that you're seeing through the patients that you're meeting? Like, what is happening on the ground? Are there people in real dire need that are just being left behind by society?
Yes, certainly there are, and it's very sad, and it's the reality of life in the West. The reason I am emphasizing on the West is that that is where we are geographically placed right now, and that is where that is the area I want to touch upon. And I think the issue also is that when someone is facing financial crisis, people around them, relatives, friends, almost always lose interest in them because there's nothing they can get out of them, and they almost seem like a burden to the rest of the family or society. And then this person becomes the responsibility of the healthcare system, the NHS, for instance. A very good example is Christmas time, when we get loads of geriatric admissions to A&E just because family members are unable to attend to, you know, their elderly family members.
Really?
And
Okay.
they are then sent to A&E because, I don't know, the boiler has broken down, or, you know, there's no member of family to look after them, or someone has gone on holiday. And this is a very common occurrence. This is something that happens all the time. So I think, you know, unfortunately, the reality of life really is that when you are going through financial crisis, people around you naturally lose interest in you. And it's then that you need to access care, you need to speak to someone, and your point of contact then becomes your NHS GP. And I'm an NHS GP myself. I still work in the NHS, and I think they're doing a tremendous job, because what they're doing is, with very limited finances and with very limited time, they are your social worker, your mental health counsellor, your doctor, your friend. You can confide in them. But what I'm also seeing on the other end now, with the junior doctors strike and the morale of the workforce, is that we're burning out, and there's a lot of compassion fatigue. It's a term coined to express the feelings healthcare workers are going through, which is essentially running out of compassion because they're so tired and burnt out.
Wow. So are you saying that doctors are forced to step up because others aren't there to take care of people who are in need?
I think it's always been the case, but it's worse now, because we simply don't have enough social workers, mental health counsellors, mental health services. The waits on the NHS are dire. I'll just give you a very small example. For you to be seen by a psychiatrist can take anything between 2 to 4 years.
Wow.
I mean, how can someone with a mental health problem or pathology wait that long? It's mental health, right? If you want an ADHD autism assessment, if you want to access care, especially in the psychiatric arena, it's almost impossible. So that's where public-private partnership comes in, and that is where we support our patients. Of course, it's expensive.
Just one more thing about poverty, perhaps, and then we'll go over to what you've just raised. People who are generally poorer, are they accessing all the services that are available? Are there access barriers that you see for people accessing the services they have a right to
The lack of
seek?
advocacy is a big thing. We need advocates for people who are vulnerable. And I sometimes think that people who are suffering from poverty are very vulnerable in many ways, because they're socially isolated, they have mental health challenges, they're going through a very rough time. And I'm not very confident in saying that they're able to access care the way they should, or that they even have the know-how of how to access care in the right time, in the right fashion. So I would be concerned about that. And I'm not very confident that they do.
What do you mean by advocacy in this space?
When a person is vulnerable, we as doctors, for instance, are taught that we need to be the advocate of anyone who is vulnerable, which essentially means a person that is a child, cannot consent, an elderly person who has some mental health problems, for instance, or suffers from dementia or is socially isolated, any woman or man that are, at risk of domestic abuse or are victims of domestic abuse, financial abuse, emotional abuse, those people are vulnerable. And as doctors, we're taught advocacy of people who are vulnerable. And I feel that in the medical space, social space right now, there's lack of advocacy, there's lack of understanding, help for such people out there. These people are not represented in spaces where decisions are made. These people are almost excluded.
And are they the majority?
The vast majority at the moment is struggling, yes. I wouldn't say that everyone is poor, but I think almost everyone is struggling when it comes to paying bills, when it comes to making ends meet. I certainly feel that there's a very small minority of people who are doing exceptionally well, and poverty or lack of resources is almost a norm now.
And do you have to almost hear those stories from people, just their economic struggles of getting by?
Day in and day out as an NHS GP, yes, day in and day out. I mean, sometimes we had really sad stories.
It's very heavy to hear stories.
Very,
that you can't
I'll give you a very small example. So I saw this lovely Afro-Caribbean lady who had not picked her diabetes medications for a long time. I want to say almost 4 to 5 months. And I asked her, I was like, why are you not taking your meds? And she said, well, I'm not taking my meds because you've put me on 4 medications and I can't afford them. And I said, you're diabetic. You're exempted from paying. You can have a medical exemption form. And she said, well, nobody told me.
Wow. So you've mentioned the need to re-strategize the whole notion of public welfare provision. And in the course of today, you've hinted at 2 poles. One is community, one is private provision. If I start with private, there's a lot of fear about private healthcare and privatizing the NHS and making it look like the USA, and we've all got scary stories about US healthcare. What do you think is a form of private-public partnership which will save public healthcare?
I think that there is absolutely nothing to worry about. I'm not sure that we'd ever be going on to the American model, but it would be a case of using private healthcare for things that are more acute, things where you need to access care more quickly, but then perhaps using the NHS for chronic conditions, cancer treatment, childbirth, obstetric treatments and things like that. And I certainly see that is happening right now anyway. And what we need to understand is that the private sector is not here to compete or take over the NHS, because the NHS cannot be taken over. The idea is that both private and public healthcare systems work in sync, and any overflow patient is seen by private partners, and they support the NHS in delivering care which is timely, which is efficient, because that is what we're lacking in the NHS right now. So we're lacking efficiency, and we're lacking the fact that you can access care in a timely fashion. So as long as we are clear about that, then I think there is absolutely nothing to fear about. And also, I was quite surprised to know that, when we opened up our private healthcare, there were so many people who didn't know how they could access us. They were asking questions like, do I need a letter from the GP? Do I need a referral? Can I just walk in? And they were really surprised when we told them that all they need to do is walk in. They need no referrals, and they can actually speak to our GPs. We can do the referrals for them. We can do blood testing, everything, and we can actually listen to them for much longer than the 10 minutes that are allowed in the NHS for you to speak to your GP.
Okay, Dr. Anita, I just want to switch over into solution provision. You've hinted at a lot already. Somebody who's financially struggling, which is a lot of people, like the patient you meant who's struggling paying for diabetes medicine, they would struggle, I imagine, accessing private healthcare. Unless you mentioned previously through friends, family, and you said a lot of people do that. They sort of pool funds.
They try and find a way to pay for private healthcare so they can get a solution to their problems.
Because there's no other accessible
That's
way
right.
to solve health problems in a timely fashion. So if you look back at the public healthcare setup, which we've said is struggling, and it will struggle to go back to its early promise, what's the way to improve it then?
I think we need better representation. We've had governments, previous governments, come in, make promises, but I think we're beyond that point now. We've heard, big names making big promises but not being able to fulfill them. It's time that we take our NHS workforce very seriously. It's time that we actually give them credit for the hard work they put in. We pay them properly so they stay. We're suffering from a great brain drain at the moment in the background. 25% of people who get into medicine and qualify from the UK, medical schools do not end up staying in the UK or leave medicine. So that is a high proportion of doctors that we're losing. I think we need, two types of solutions to this. One is we need to have representation in areas where it makes a difference. Our people, our representatives need to be lawmakers so that they can make law, change law. They need to be able to voice the concerns of our communities. We need to focus on retaining our workforce. There's a mass exodus happening in the background at the moment. If you look at 2022 alone, 1,000 British doctors left the UK. That's a huge number. So I think at the moment, the most important thing is that we need representation.
With the representation, we can improve accessibility. With the better salaries, maybe we can keep some more doctors. But it seems it's the funding that's only so much to go around on that side. So I guess you're saying is there are some almost structural problems. We just have to do our best to make it more accessible, make it more fair to people who are struggling, offer the paid alternatives for those who can afford or pool funds together. It seems we're not discussing an ideal world, we're discussing a better way to catch people. So it seems we're almost forced to go back to your very first comment, which is about community. It's about spaces which aren't part of government provision or private provision, but it's everybody else. So going back to your first comment, what is community's role in building a healthier Britain?
It has a huge role because bear in mind, people from different cultures, different religions, different minority ethnic backgrounds may not agree with what the government is deciding for them because A, they don't feel it's the right decision for them, B, they don't feel heard, and they certainly don't want to take that advice on. In a situation like that, it's of immense importance that community centers, different charities are supported by the community itself, because that is where these people will come. These are places of trust. These are places from where these people will be taking advice. And we certainly, as doctors, try our best to be part of such community events. We attend such community events. We attend charitable events, organized by different charities, so that we can actually access and help people from deprived backgrounds. And I think that is the best way to be able to disseminate a message, because that is the place of trust for these people.
Okay, so that sounds really interesting. So in our larger series of conversations here, we're seeing a Britain with a lot of fractured communities, people being left behind. We're seeing a narrative of hatred, saying if you hate some people, it might make the rest of the country better. We all know that's not going to solve anything.
Never.
There's the narrative of just keep calm and carry on, it will fix itself, but we've also seen it's not getting fixed that way. And so a lot of these conversations come back to the same point. It's almost a new future of not just public-private support, but it's actually community, civil society sharing in the burden. And it seems there's no other possible future other than developing community and civil society then.
Yeah, 100%. Because look, I mean, when it comes to someone who is unable to get food on the table and they're from a Muslim background, where would they turn to? To their community center, to their mosque. When it is someone from a Sikh religion, Sikh background, where would they go to? To a Gurdwara. When it comes to people from a Hindu background, Hindu religion, where would they go to? To their community center, to their temples for help. So we certainly need to support our community centers. We need to support these different charities because they have access to people in need, and they are the places of trust for these people to turn to. They're not turning up in a job center asking for food. They're actually going to their community center. They're actually going to this mosque. They're going to their Gurdwara. They're going to their temple, because that is where they find people who are like-minded from similar backgrounds. That's where they feel heard. That's where they feel belonged. So it's of utter importance that we do support all such organizations.
No, it's interesting what you're saying, because it ties into what I believe very strongly as well, that the future of a Britain that is better and in
100%.
today's metaphor healthier, I think faith will play an increasingly more important role, because all faiths have this message of community solidarity and help. And all faiths have spaces, and space is prime in this, what I'm going to call future Britain, because you can have clinics and centres and food and just shelter.
Yeah.
And so if you're agreeing, then almost this need for a public and faith partnership, what should the government or the NHS be doing more to nurture this future? Is it doing enough?
I think the NHS is running very low on resources when it comes to that. Yes, it should do more, but it's not the NHS that decides. I think it's the government that needs to do more. I think there should be a better pastoral service. There should be more community centres. There should be more funding that is given to these centres, these charities, because as I say, these are places that have access to people who are struggling. And these are places where, people from different communities actually have faith in. These are places they turn to. So it's almost of utmost importance that there is, like you said, a partnership between the government, the wider society, these community centres, these charities, so that the work is actually done. And we've seen that, we've seen that during the Gaza war, we've seen that when it came to the Syrian war, where we're seeing that now when it comes to Sudan, that these different charities, these different community centres actually manage to raise money, help for people in need, whether it's within England or outside England.
Okay, no, that's really fascinating. I
Yeah.
saw you on a discussion talk about nurses struggling to meet basic expenses.
Do you know that we have doctors in London, junior doctors, who are actually taking up Uber driving because they can't pay the rent? Because
Really?
London rent is, yes, it's so ridiculously high that on their normal wages they can't. We have nurses, and this isn't hearsay, this is documented stuff, that nurses are turning towards food banks for food.
Well, no, this is...
And this is what I'm saying when I say that we are suffering from a huge brain drain, when we are losing staff, because these are highly skilled workers. What we're failing to understand is that there is a huge market outside England for these people. These nurses can easily go to Dubai, Qatar, Australia, and have a very easy life. We need to hold on to these. And the question that you asked about funding and pots. So the issue I have is that our government does have the funding and does have the pot,
Really?
but they don't make the right decisions. Now I'll give you a very small example. They did not agree to increase the pay of junior doctors, which has been frozen for the past sort of 13 to 15 years now against inflation. But they were ready to dish out £3 billion on junior doctor strikes for cover. Where did that money come from? Why did they not simply pay the workforce? Why? So I think the biggest issue we have in this country is that our lawmakers don't listen to us. They don't listen to the public. They have their own agenda. They enforce things. I remember there was a time during the previous government where they spent £250 million on cloud telephony systems, which most GP surgeries already had. Why are you spending £250 million on an IT system when you could spend that money in training more doctors, creating more posts, getting more GPs in, getting more nurses in? Why? Who is making these decisions? It almost seems like, these decisions aren't made for the benefit of the public, but are made for the benefit of different people in different positions, their own benefit. And it's scary, it really is. And so when it comes to funding, I think the funds are there, but simply not being utilized the right way. And people are demoralized. I'm not joking. When I was a young junior doctor, our shift used to finish at 5 o'clock and we used to stay back to 7 o'clock just out of sheer goodwill. Now, the junior doctors, when they finish work at 5, they go out at 5. They don't want to stay back for goodwill. They've run out of goodwill. There's nothing left to give.
Wow.
So it's it's ironic. What I was getting paid 15 years ago as an F1 is the pay of an F1 today against inflation. So it's not fair.
No, it's not.
And these guys are, very, very educated people. These are doctors. They're not going to stay. And then when it comes to things like subsidy, they'll say, oh, it's hugely subsidized. It's not. They take their own loan. Gone are the days when, medicine was subsidized. They take their own loans. These loans incur interest. It's not subsidized. They don't get free accommodation like they did many years ago. They don't get free tuition fee was £1,000 a year. It's gone up to 10,000 a year. It's not the same. You cannot bind these people in a contract to stay and work for the NHS if you're not giving them a fair pay.
Wow.
So, somebody asked me the other day, I was on Dr. Hillary's podcast. So I was in London this last week, and he said, would you encourage your sons to become a doctor? And sadly, no.
Wow.
Because my husband is 39 and he got into medical school when he was 19. I met my husband in medical school. We've been together for a long time. And he just became a consultant this September at the age of 39 after finishing a PhD in medicine. He's a hepatologist. And it's 20 years worth of education, exams. And it took him 20 years to be where he is today. It's a very long, rigorous training that you get. It's got to be worth your while.
Wow. I don't think people realize the scale of poverty within the ranks of healthcare providers.
They don't. I mean, how many times have I seen doctors say, sorry, we can't do this because we can't afford it? It's a very common line that I hear amongst healthcare professionals. Sorry, I can't afford this. I can't afford that. I can't afford a holiday. I can't afford this. I can't afford that, because they simply cannot afford it. The wages they get, especially if they're living in areas like Kent and London, training there, I mean, it's just not enough.
When you said there needs to be more representation, you actually mean now all the way up.
All the way up.
Because you're saying
we
right at the top table,
definitely
decisions aren't made in the interest of the public. It's almost as you're
100%.
going that far, basically.
That far. Otherwise, if you're not part of the decision making, then nobody's going to care about what you think. We need our people to represent us. Whether it's people from the medical field, for instance, because I'm a doctor, whether it's people from the ethnic minority backgrounds, we need representation. These people need to step up. Our people need to be within the GMC. Our people need to be within the local government. Our people need to, if they're not, then how can we expect that they're going to know our narrative? It's just impossible, isn't it?
So we need you to go into political advocacy as your next career.
I don't have the bandwidth. I wish I would. My father was a politician, but I think his journey was so adventurous that I genuinely thought, oh my God, he was in exile for 17 years of his life. So I just feel that, looking at him, I was hugely discouraged. I was like, no, this is definitely not the path I want to go down. He was a political activist in Pakistan back in the day. He was with Zulfikar Ali Bhutto, who was Benazir's father. He was the advisor, and of course there was a martial law and Islamic regime that came, and things were, it was a dictatorship. There was no democracy and things, and he was part and parcel of all of that. He was victim of it, and I just looked at his journey. I was like, I don't think I want to do that.
Okay, no, that's really fascinating. You asked me when I met you today, what kind of doctor am I? And I said, I'm not a proper doctor. So a little bit about myself. So I've been an academic in Islamic law, but it was just my deeper reflections on what's ultimately an ancient code of communal organization. And my reflection on Zakat, because Zakat is a faith tax, if you like, but it's meant to be organized locally. And local is actually meant to be within cities. So as I reflected more about Zakat and the other provisions of Islamic sacred law, I just realized that what faith is meant to do is make us organize in our cities and regions where we live, how to circulate funds and create a leadership. In Birmingham, we are trying now to create almost a poverty forum to bring together faith actors, to pull together funds, and to be a point of representation with local government and other actors. So it's just really fascinating that it's almost we've converged. You're what I call a real doctor.
No, that's not true. I
Academic
genuinely no. I'm
doctor.
a medical doctor, yes.
I've studied ancient wisdom, if you like, of a social legal
Yes.
sort. You've studied longevity, medical practice. We're almost converging in the sense that community in its widest meaning, which you started with Ummah today, faith centers, faith messaging, circulated welfare, is the only way to create a healthier Britain. Would you say that's the conclusion?
100%, because it glues us together. You know, faith glues communities together. And that's where we come to, and you know, we turn towards faith in our times of need. We turn towards these community centres, mosques, gurdwaras, temples during our times of need, because that is where we find solace. And we certainly need to come together, and there needs to be a long-term partnership for this to work.
Thank you so much. It's been really fascinating talking to you today. I know from talking to you before filming and today, you really care about people. You care about the people you're helping. You care about the people being left behind. And it only is this, I think, multi-sector partnership that we can carry this together. So it's been a real pleasure talking to you today.
Thank you so much for having me on your
And
show.
may God accept and bless all the work that you do. And look forward to maybe talking to you again at some point in the future.
Thank you.
Thank you so much.
Oh, really? You've come from London?
Yeah,
and they've
yeah.
come from Manchester?
Yeah.
Amazing. How's
We
life
met
in London?
the middle.